Hello, I'm Carolyn Jones with the Washington State Department of Social and Health Services. Welcome to another workshop on the web. You're about to view a video regarding the needs of young people who are gay, lesbian, bisexual, transgender, or questioning. Studies have found that gay, lesbian, transgender, bisexual, and those youth who are questioning their sexuality are twice more likely to attempt suicide in their teen years than those that are heterosexual. Kids placed in out-of-home care already are dealing with a host of negative feelings due to abuse and neglect. It's important that caregivers understand the special issues that these youth face and help them to become healthy and productive adults. For this reason, we urge you to open your hearts and your minds to the compelling young people you'll meet in this video. They've exercised a great deal of courage in sharing their stories with us. On the page with this video, you'll find a link to a discussion guide, which you'll also find helpful. Print it out and keep it for future reference. We so appreciate what you do for the children in your care. Thank you, and enjoy the video.
What are you going to add with it?
I just need butter.
Some butter?
And salt and
Thank you. Ingmar. Sit. Spin.
To be honest with you, it scared me to death. I had never dealt with a gay youth.
My name is Tyler, and prior to going into the foster care system, I lived with my mom and my stepdad. We lived in a small town in Washington. It's not exactly the most comfortable situation living with your parents who aren't really accepting of you, and knowing that you're different is always on your mind, and it makes you scared of what your parents will think. I always felt evil in their eyes.
Being a foster kid and bouncing around from group home to group home and foster family to foster family, you get this really strong sense and worry that nobody really wants you, like you're not good enough to keep around. And so add that to the fact that I was gay and I had something to hide, and you're walking around with this horrible sense about yourself and what everybody thinks about you all the time.
When I was in junior high, I had a crush on this girl. I was like, oh my God, what is wrong with me, you know? I'm not supposed to like girls. This is disgusting. What's wrong with me, you know? And my family didn't understand, and I didn't even know what a homosexual was until I was about 15. I'd heard the word homosexual going to church and being with my parents, and we'd study the Bible, and they never explained to me there are people out there that love people of the same sex. And so that was really a big shock to me. I thought I was just the weirdest person ever.
I would say right now I'm more attracted to men than women, and I think, if I had my way, I'd like to be heterosexual. You know, there's the debate whether it's a choice or if it's something you're born with, and I don't know where I would stand on that, other than just to say that who would choose it? You know, who would choose a life of ridicule?
In my foster family, my foster mother, but
she didn't do in physical abuse, she made up for with verbal abuse. Like, every chance she got, she told me that I was going to hell. And I knew that it was because of my gender nonconformity, but obviously I didn't have those words when I was 7 and 6.
I identify as a male only when I have to. For courts, for, say, someone wanted to take me to church. Just a whole respect thing when it's necessary. Other than that, when I go to school or when I'm hanging out with my friends or when I go out to a party or something, I dress in drag.
When I think of transgender and think of how I use it, it's just kind of that I don't identify with the gender that I was born into, and gender queer is just how I consider myself really gender fluid, and I kind of consider myself a little bit of both genders, kind of just pushed into one.
I identify myself as genderqueer or gender fluid, meaning that I don't subscribe to the binary system of gender. So I believe that people have characteristics of both masculine and female types. When people ask me like what pronouns to use, it's pretty much I tell them to use whatever they prefer. I mean, I'm not going to be upset if somebody uses she for me because I do have the female anatomy, but I see myself as more masculine, and I feel more comfortable having people use male pronouns.
I realized I started liking girls when I was in 6th grade, so when I was like 12. It was just hitting me harder because I had like all these crushes, and I thought that, you know, I was really abnormal.
When my stepmother asked me to change, I really felt like she doesn't understand. And even though she has family who is GLBTQ, she still doesn't understand. So, I mean, that's just how people are, and I just hope that they would change eventually.
Some people use the acronym GLBTQ, and some say LGBTQ. But we're both talking about gay, lesbian, bisexual, transgender, and questioning individuals. Transgender is a term that a lot of people aren't as familiar with, but it refers to gender variations, including individuals who have some male and female characteristics in their body. It also refers to individuals who have a typical male or female body, but their internal sense or perception of what their gender is does not match that body. And it refers to people who, for whatever reason, prefer to dress and behave in a way that doesn't match what the culture expects for someone with that gender. The term questioning refers to people who are going through a period in their life when they're uncertain about what their sexual orientation or their gender identity is. It can happen for heterosexual and for gay, lesbian, bisexual youth. It's very common in adolescence, but it can also occur at any point in a person's life.
First, we have to make sure that the young people are seen and noticed and acknowledged that they are living human beings within the system of care and that they need services. So it's the invisibility that really is a kind of a special need.
I first realized that I was gay probably when I was about 5 years old or so, maybe a little sooner than that. It's not really, I couldn't label it. It wasn't like something I knew what it was, it's just I knew I was.
Like I said, I realized that I had feelings for girls when I was 12-ish, and I pretty much hid it from myself and everybody else, and I tried really, really hard not to be.
I was able to label myself as gay when I was about 8 years old because my mom, she's the one, like, because I came out to her when I was about 8 years old, but, like, I didn't know it was coming out because, you know, I didn't know that I was really coming out. I just, you know, told her, you know, I like guys, and she said that, you know, like, well, duh.
I think that I didn't choose it because I didn't really know too much about it when I started realizing how I felt about girls. So.
Actually, Shondell helped me understand that. Because I think in the beginning I did kind of ask her a lot, are you sure? You know, are you really sure? And how do you know? And she said, when you kiss Dad, do you get a little excited? And I said, well, yeah. And she said, yeah, if I kissed a boy, I would feel nothing. And so that I thought, well, gosh, that is really, that's it right there. This is how she feels.
The child is how the child is. That basically how the child comes, you can't try and mold the child to what you want that person to be. That person is who that person is. And whatever they are, just love them for it, just the way they are.
There are some groups and some individuals who claim that they can help a GLBT youth stop being gay through what they call reparative therapy or transformational ministries. While they may be very well-meaning, the research has consistently shown that their efforts do not produce an actual or lasting change in sexual orientation, and in fact they may be doing more harm than good. For example, an individual who doesn't change may experience anxiety, guilt, depression. They may resort to use of substances or even consider or attempt suicide. I think it's important to note that the American Psychiatric Association over 30 years ago said homosexuality is not a disease, it cannot be changed, it cannot be cured. It is a normal variation on human sexuality. Since then, many organizations have endorsed the APA's position on this. And in general, what they recommend is, if you're a social worker or a parent, it's best not ever to refer a child to a therapist or anyone else who says that he or she can change a child's sexual orientation.
When people say that it's a choice to be lesbian or gay or transgendered or whatever that you are, I don't agree, because I don't choose to be discriminated against, or I don't choose to be, I don't choose to have mixed feelings about the way I am because I'm different from other people. So I just don't feel that was a choice. And even when I was in preschool, I mean, I was attracted to females. I really was. I remember that clearly. I do. So I don't believe that it was a choice at all.
I'm a normal person, and, you know, gay people are normal too, and it's like, you know, I wouldn't do anything with kids. I mean, I don't know what people are going to think, you know, what they're going to assume that I'm going to do, but it's like when people are afraid for me to, like, play with their kids or something, it's just kind of weird to me, and I'm like, whatever.
This one woman, she read in some paperwork where it said that I was gay. I didn't really tell her that I was bisexual or gay, and her first response was, well, I hope that you don't show any, you know, I hope you're not interested in my son, who was a young teenager. And I think a lot of people that are ignorant to different sexual orientations other than heterosexual may think that, you know, that gay men are pedophiles, or that they're, you know, they do stuff that, you know, do outlandish things.
Some people have a concern that GLBT youth are more likely to sexually offend against other children. In fact, the research shows us that they're no more likely to offend than a heterosexual youth in the same situation, but that we do need to be concerned about them being sexually victimized themselves for a number of reasons. For example, we know that in 95% of the cases of sexual abuse, the perpetrator is an adult heterosexual man. These individuals are adept at identifying or discerning that a child is keeping a secret, which makes that child vulnerable to sexual exploitation. Also, if we don't allow young GLBT people to date people their own age, they're more likely to date people who are older, which sets them up for sexual exploitation. And there does need to be some concern about them being targeted for sexual violence outside the home and sometimes inside the home. So contrary to the myth, GLBT youth are no more likely to offend, but are at higher risk for being victimized themselves.
Gay and lesbian isn't that you have sex with, you know, the same sex. It's not anything about that. I mean, there's gays and lesbians out there who have never had sex with the same sex. And they're still gay, and they're still lesbian. It's more of how you feel. I mean, do you feel more attracted to the same sex, or do you just feel more akin to them? More like you can build a relationship on that? Then, yeah, you're gay.
If you think it's just strictly sexual, it's not. There's more to a relationship than sex, and I have to make that clear because I've had a lot of people say, you know, you're just a lesbian and you have sex a lot. And I'm just having to tell you now, it's not true. I've been with this girl for 3 years, or almost 3 years in September, and you tell me if it's strictly sexual, I think not.
A lot of people think that bisexual people are just dirty and slutty and just want to be with everybody, but that's not what it's about. And it's more about just finding the right person for you, and it doesn't matter whether it's a girl or a guy.
People who think that because I'm gay, I only like to be with females sexually is not the case, because I feel like females, they understand where I come from more than a guy would, and they're just more affectionate to me than a guy, than I felt with the guy, because I've been with the guy before, so it had nothing to do with the sex or anything.
My religious faith has played a big part in me coming to terms with myself and helping others come to terms with themselves. I practice the Buddhist faith, and because of my Buddhist faith and the basic philosophy of Buddhism, I've been able to realize that through my current circumstances, I can accomplish anything, and that because of my circumstances, I can go anywhere.
I was raised to believe in God, and I do believe in God, but it took me a long time. Like, I stopped praying for a really long time because I was like, well, I'm not good enough to pray to him because I'm a terrible sinner and I'm going to go to hell. And I had reconciled myself to that because that was what I was raised to believe. And I guess in the back part of my mind, I still kind of believe it a little, but I'm not terribly afraid of it because everybody talks about God as this loving being, you know, that cherishes life and is accepting and forgiving and all that and gracious.
I am a religious person. I am Baptist, Southern Baptist to be exact. I don't go to a Baptist church at all, but I do believe in God. I know what the Bible says, that homosexuality is wrong, but I believe that God accepts all his children for the way they are. And I think it was cool because I went to church with my dad a few weeks ago, and he was like, you know, the Bible says that being homosexual is wrong, but I believe that God accepts all his children for the way they are. And I was like, thanks, Dad, for thinking that.
I've tried to be involved with Christian or religious organizations, and it's tough to be involved with the organization and hear them ridicule or to say that homosexuality is wrong. And I mean, it's almost like they're telling me that I'm committing a crime, you know, and that I couldn't imagine any God that, first of all, I think that God created me to be bisexual, because if he didn't want me to be bisexual, I wouldn't be bisexual. And I think that if if I think that, you know, if God, I would want to worship a God or a religion. I'd want to partake in a religion that accepts people for all of what they are, not just bits and pieces.
I almost died of malnutrition when I was 3 years old. I only weighed 18 pounds.
From the paperwork that I've read, he was getting into nail polish and makeup and things like that, and his parents dealt with that by trying to beat it out of him and make him act more like a boy should act by, you know, making a man out of him, so to speak. And so they were very rough with him. They were very cruel to him, and his siblings followed suit. And I know that his clothing was set on fire while he was wearing them, and he was stabbed, and he was nearly starved to death.
So I was just kind of scared, you know, because like I didn't know when I was going to be yelled at next, or when I was going to be set on fire again.
Unlike other young people who come into our foster care system, many of these young people have been thrown out of the home. In fact, studies done in many cities find that up to 50% or more of the young people who become homeless each year are LGBTQ. These are young people literally thrown out of the home. So when they come into our system, many of them do not feel safe in family environments.
One of the houses I was in for the longest time, I was in the house for about 8 months. I remember that we had a transgendered youth move in with us, and he was in the process of transitioning to the female gender, and it was a military household, and the lady in the house would constantly say things about him behind his back. And I knew that transgendered people were also part of the gay community, and that made me feel inadequate, and it made me feel even worse about myself, because I wondered, what if she found out that I was gay, and what would she say about me? And I was really scared.
They need this support. They need that respect. And I'm not just saying that because I love Tyler. I'm saying that because there are many gay youths out there, and there are homeless gay youth. Some parents need that education also, because when the child comes out, or if they accidentally find this out, they're kicked out of their home. So they're at a higher risk there, living in the streets.
I thought that I was really at home for the first time with that foster family, and then they didn't want me either. And it was like all these hopes that I'd built up based on this foster family were just demolished because they didn't want me anymore, and I couldn't escape that feeling, and those thoughts were always at me.
There isn't a safe place on the streets. Maybe you'll make it through one night, but you never know what's going to happen the next. You know, I made a lot of dumb decisions. I hitchhiked, I slept in public places, I crashed in houses that you just don't crash in, you know. I mean, it's not a normal childhood to watch people shooting up and, you know, smoking drugs, and, you know, to think that that's normal, it's just not okay. It would have been a lot better if I could have just stayed home.
I've been homeless, and you know, and I worry about being there again. I worry almost on a daily basis.
My experiences in school. Well, in junior high is when I came out. In junior high, junior high is kind of those times when everybody starts to group up and everybody starts to see who they are and feel their perspective of everything before high school. And identifying as bi was really tough for some people because they just didn't know how to handle it. But then I did pull through with some friends, Now, high school is a different story. High school, you have less accepting people, more empty-mindedness. I mean, I could tell you stories about how I got kicked out of schools because people didn't agree with the way that I am, and it caused problems and conflicts with people.
When I wanted to come out, I was scared because of the things I saw in the news and the way people talked at school. I didn't want anybody to know. I didn't tell anybody until I was in 9th grade, and I knew when I was in 7th grade. That was very hard for me. And actually, I quit school because there were a lot of people that would stare at me and say disgusting things.
High school was the worst. I mean, I got called everything from homo to bisexual to transgender, tranny, transsexual, you know, gay, lesbian, dyke, and all my life I had no idea what these words meant. None of them. My mom claims that she remembers me coming home and saying, I don't want to be a homo, you know, because whatever people were calling me is something I knew I didn't want to be.
High school and middle school can be very dangerous places for sexual minorities, and as foster parents, you need to be aware of what's happening at school. You need to be asking your child, you know, is there harassment going on? And the foster parent needs to be prepared to step in and advocate and make sure that there's a safety net in place for that child.
Prejudices are very dangerous. There are people who feel that because I don't agree with this, you need to be dead. And that's absolutely true. We have examples of that everywhere. So I was very careful, made as much as I could be without smothering this child. And I talked and talked and talked. And then finally he was old enough to go into Oasis, so they did safety things of all kinds, which is one of the best things that could have happened.
Being gay sometimes leaves me feeling as though there's no one I can really turn to, because I feel as though there's not really anybody that can understand. And for a long time I battled with depression and constant suicidal thoughts, and I even attempted it. And if it wasn't for my foster mom, I don't think that I would have gotten through those times. And I'm really thankful to her for that. And I learned by going to my local youth center that it isn't unusual for foster kids to feel that way, and that we're one of the largest groups of people who have those types of feelings.
I'm an underage drinker and I'm highly tolerant to alcohol, so that's one of my outlets to me feeling bad. Another thing that I have done was actually cut myself because I felt so bad about myself and like the way things were going around me. And I realized that was pretty stupid, and I had to learn to love myself in order to actually love somebody else.
Like, had I stayed in foster care, I probably would have committed suicide by now. But now, since I'm here, I'm still here, and I think that my future is has just a positive outlook as any other person.
It's one thing to look at the risk data and to acknowledge that these young people face particular risks, but it is not fair to then assume that all LGBTQ young people engage in these behaviors, or that LGBTQ youth in general are somehow predisposed to these behaviors. These behaviors are, in many cases, a response to the environment. And by helping young people find a safe environment, you will see these behaviors dissipate.
Well, my experience with being closeted was, I was really depressed. I didn't want to talk to anybody. I thought that nobody would understand me. I thought that I was just really weird and that I didn't belong.
Well, I am a lesbian, but I think if I was to live a heterosexual lifestyle, that I would just, I don't know how I'd feel. I think I would just feel just caged. Like, I think that if I was doing that, I wouldn't be comfortable with myself or love myself or even be, like, proud of who I was. And I think that if I was dating a man, I would just be hiding a big part of myself.
I think it's kind of ridiculous to, you know, make people hide who they are, because it makes you angry at the world, you know, and you can't function in a normal life if you've got this huge secret hanging over your head and you're unhappy all the time.
I did come out when I was 19, and I was so scared. I was sitting on my bed, and I asked my mom to come into my room, and I wanted to talk to her. And I told her about my friend Jessica that I'd been hanging out with, and then I said that we had started dating, and that I was really interested in her. And my mom was surprised, but then she laughed and was like, you know, everybody said that you were gay, and I was like, no, she's not. It's like everybody else kind of knew.
She was shaking so bad when she told me. I was afraid she was going to tell me that, you know, she was going to go to prison or something ridiculous. I just said, oh, is that it? You know, what's the big deal? To me, it was nothing, and I gave her a hug and said, is there anything else? And that was it. It just wasn't anything that I needed to worry about.
Some people that are out aren't open to the community. There's a difference between in the closet, in the room, and out. And those are my three concessions. In the closet being not out, but you know about it. In the house meaning you have a certain limited people that you tell, like such as your best friend or your family. Being out with the community, you don't care, who knows. So figure out what level of being out they are.
I don't think that I need to announce it from rooftops, but I don't think I need to tell the world about my orientation, but I could tell the people that are, you know, closest to me. I don't agree with, and frankly, I don't think that it's really anybody's business, really. I mean, other than just, you know, I think it's only anyone's business but who you want to share it with.
For many young people, coming out to an adult is a really important event, and I think for a caseworker it's important to understand that you are seen as a helper for this young person, and you may be that one person in this young person's life that this young person feels comfortable talking to about this issue.
Tyler came out to me, and I kind of wondered, because often the conversation about gayness would surface, then he would mention a gay classmate or a person that cross-dressed. And with his eye contact, I felt that he was wanting to know how I felt about it. So when such a conversation come up, I said to him, "Are you gay?" And he said, "Yes, I am." And I said, "Wonderful, you admitted that to me. That pleases me, and I'm glad you're relaxed enough to share that."
Many young people will come out to the adults that they trust, but it's not a failure on the part of a caseworker. If working with a young person that you might suspect is LGBTQ, if that young person does not come out, it doesn't mean you have not done your job. But you can still be supportive. You can still signal to that young person that you are a person to come to if they would like to talk about these issues.
It would be a lot easier for the transition for foster kids if the potential foster parents for the foster kid and the caseworker could get together and meet and discuss whether or not this is a good placement rather than just placing kids wherever there's a spot open.
That, you know, not only are the parents accepting of that lifestyle, but also that the other kids, biological and foster kids, or whoever, that everybody in the home is okay with it, not just somebody or some people, that everybody in the home is okay.
When you get a foster kid and they tell you, I'm lesbian or something, your reaction shouldn't be shocking. It should be, that's great, you know, I'm happy for you. What do you want for dinner?
The main thing that I would just tell a person who's going, or a foster parent who's going to take in a foster kid who is GLBTQ, is just to have an open heart and mind about who the kid is and accept them. Just accept who they are, because they're still the boy or girl that you want to take into your home.
When we accept a child in our home and we find this child comes out, or we discover that this child is gay, it's not our role to try and change that child. It's our role to change our own thinking and feeling and educate ourselves on how to nurture this child and accept that child.
If you're going to be a foster parent, you have to be open to almost anything. And if you're not, if you have a lot of restrictions on what you're open to, don't get into being a foster parent, because you really, you know, you're doing, when you think that you're trying to do good, unfortunately you're doing a great disservice.
I think it would make it very comfortable for foster kids who might be closeted as gay or lesbian or bisexual or transgendered if foster parents had like maybe a small poster on a bedroom wall or in the hallway that said this is a safe zone, or like all families are welcome here. There's little posters like that like have little rainbows on it and little things that just say that all people are accepted.
If the foster families can say to them, you can tell us anything. Whatever you're going through, we'll understand. We're here. We can listen. We're not going to judge you. We're certainly not going to tell you that you're going to hell. Then it gives the signal to the young person that, wow, when life happens and things happen to me, I know I can go talk to my parents. And that's really what pretty much every kid wants to have.
When a caseworker has a gay child on their caseload, I think that they should also be well-versed in local resources, because they need to make referrals and call the organizations to get information for their youth, and they need to keep constant contact with their youth.
Definitely have like a resource like PFLAG, you know, for people that you can ask questions to and, you know, figure out how to deal with like certain situations.
Now I feel very welcomed and very, you know, proud to be different and proud to be gay, and I'm not scared really anymore.
The great thing I've come to find out is that the foster care system often gets a really, really bad name, but it's not as bad as it's made out to seem. I found the perfect home, and I've fallen in love with the people I live with, and it's absolutely wonderful. And if it wasn't for my current foster mom and sister, I don't think that I would be who I am today and be talking right now to all of you. So foster parents should feel really fortunate for the opportunity that they have. They can really help change someone's life.
I really want to be a teacher. I really want to have a job that's involved with kids and does something for the community, because that's something that's really important to me.
There's about 1 billion things I'd like to be. One of them, like, I want to be an ASL interpreter, which is American Sign Language.
Through my experiences in the foster care system and also being gay, I've come to the conclusion that I want to be a social worker myself when I grow up.
You know, I like different things. I like animals. Like, I consider myself more of an animal lover than just a trans person.
Get my degree in graphic design and social economic studies, and I also want to eventually work in a corporate building, make it to the top, and be the boss. That's my answer. That was my answer. Okay.